So thanks for joining us for our third video in the series. Again, we're looking at neck, shoulder, wrist, and elbow issues. This particular video is going to talk about acupressure points and some self-massage techniques that you can use when you're dealing with your acute and chronic pain issues. So acupressure, we have a lot of material that we've released already on our website about acupressure. You're certainly welcome to go look up that material, and I encourage you to do so. It gives an overview of different aspects of when that's useful. I'll cover it very briefly here. Acupressure points are specifically used for acute pain problems when you're actually having pain in the moment. For long-term scenarios, when you're not having pain, that's usually more of a stretching or general massage type case. But if there's an active spot that you are hurting and you find an acupressure point that's reactive, you can press it and hold, massage clockwise or counterclockwise for quite a few seconds to try and release the spot that's tender and reactive. So I'm going to be demonstrating a few acupressure points and their locations on Nicole here. We're going to start at the base of the neck, so I need her to turn around. The base of the neck, a few very common points that are used for pain and problems at the base of the skull are actually at the border of the trapezius, which we talked about in our first video, and the SCM, where they come up. You can find a little divot. If you run along the side of the neck up to the base of the skull, you'll find a small little curved divot here. There are a couple points in this area, one at the very base of the divot and one closer to the edge of the trapezius as well. I'm not going to be giving names in this video series because frankly that's less important than their location. But again, at the insertion of the trapezius here, there is one at the border of the muscle and one closer in between the trapezius and the SCM, the sternocleidomastoid. As we move down, we get to the start of the thoracic spine, T1. You'll find, if you trace your own spine, you'll find one vertebra that tends to protrude. Right above this, and slightly to either side of the vertebra, you will find a point that is often sensitive for cases of stiff neck or wry neck. Also, incidentally, if you are suffering, if you're an asthma sufferer or an allergy sufferer, this tends also to be sore. You can use this point for these kinds of conditions to help work out the muscles in this location. We're going to move along to the side of the shoulder itself. As the trapezius moves around, at the top of the trapezius, halfway between the center of the spine and the tip of the shoulder, which you'll have to roll over, you'll find the end of the shoulder and where the arm attaches, and it's going to fall off. At that location, halfway in between, right at the top of the trapezius, you can press down and back. It's important actually, if you're pregnant, stop it right away. This is a point that's typically used by acupuncturists to induce labor as well. If you happen to be pregnant, we encourage you not to use this point. Although finger pressure typically doesn't set it off, but for people prone to miscarriages or threatened labors, better not add to the fire. So this particular point is used also for tight shoulders and stiff neck situations. If you move a little further down, you're going to find the shoulder blade. You're going to need to find the base angle of the shoulder, which is nice and protrudy here on our model. You'll also need to find the top section of the shoulder and the outside border. Once you have these three, you can find the top ridge, and at the midpoint of this ridge, if you roll over and down, there is another point here. This is in the body of the supraspinatus. Again, this is the muscle we talked about is a common offender for rotator cuff problems. So rolling over and down here, this spot is also often tender and can be used for a variety of top shoulder issues. Continuing with the shoulder, but moving on down into the arm, if I can get you to turn to one side. Moving down into the arm, we have 2 points that are on the either side of the deltoid. So if you bring the arm away a little bit, it's not very pronounced in Nicole, but it may be in you. You'll see 2 divots where the deltoid muscle breaks away and there's an indent into the deeper musculature of the body. These two are also very commonly used points for shoulder issues, particularly in the shoulder girdle itself. If it's not a tendon problem, or if it's not based somewhere further up in the neck or in the thoracic cavity, you can find these 2 points to be very useful. Then we move down into the elbow. If you're dealing with epicondylitis pain or other kinds of elbow pain, you can find your epicondylitis and roll over. So these are the bony edges of the elbow, is the epicondyle. You can roll over and press in on the outside or on the inside here. Both of these are good for epicondyle pain, and you can move around back behind as well, back behind this way, but you have to be careful because there are large nerves that pass through this region. It's like hitting your funny bone, you're actually just pressing it, so we don't encourage you to do that, but these points can often be reactive for elbow pain as well. Moving down into the wrist and forearm. For the wrist itself, most of our reactive points are on the inside of the forearm here, at the crease of the wrist, where the skin creases over when you flex the wrist like so. You'll find 3 on each side, 1 on the far side, the radial side, 1 in the center, and 1 on the ulnar side, the inside. These can be good to stretch out and across this direction if you're having carpal tunnel issues, so long as it's not inflamed, in which case you might aggravate the problem. All 3 of these can be quite useful. For the wrist, or for pain that goes from the forearm into the arm, you can find our common point here, which is, if you take the first long bone of the forefinger, find the midpoint and roll off into the webbing between the thumb and first finger, you will find this location. This is a point that's commonly indicated or used for headaches, although it's not typically used that way for musculoskeletal problems. And this is another point that is not to be used for pregnant women as well. It's another point that's often used to induce labor. And also, if you move back from the bone of the wrist, the carpal bones, back over, you'll fall into a divot on the extensor side. So we're going to do a quick review. We know we've covered a lot of points, and if you haven't been palpating these, finding these on yourself, these are all points that you can find on yourself. It's really quite it's quite simple to follow along. So we're going to cover them all again, just so that you have them all as a record. And I'm going to mark them quickly with a Sharpie as we go along, so that you get an idea, again, roughly where they are. So we move up from the base of the trapezius, up into the divot between the trapezius and the SCM. We have a point there, there, and a point at the base of the trapezius, the side there as well. Then we go down to the large bone. This is T1. Roll up and across. Very briefly on either side. We have 1 on either side. Same point. From here to the end, find the midpoint. The top of the trapezius, we have a point here. One side of the scapula, and the other side, along the ridge across, find the midpoint, roll up, point here. Along the side we have, in the spaces, the divots on either side of the deltoid attachment, we have one here and one here. Either side of our epicondyles, you find the edge of the epicondyle, the edge of the elbow, roll over and in is 1, and roll over and in is 1. On the wrist, at the crease of the wrist, we have 1 on each side of the bone and 1 in the center, here, here, and here. Find the long bone for the forefinger. At the midpoint, roll in into the webbing between thumb and forefinger, here. And then at the end of the radius, our large elbow bone protrusion. Find the center and go towards the elbow. You will roll past over a muscle into a divot in the tissue.
So going from acupressure to self-massage, it's really nice to get a massage, but you can't always get in to do it, and sometimes you don't have the time necessary. There are a lot of things you can do at home that will help you release some of the muscular tension. As we mentioned in an earlier video, most of headaches are caused from tight muscles in the neck. So what you can do is take your fingers and find the base of your skull and come down and make firm circles, and when you find a tender area, you can just hold on to it for a moment. If you're ever feeling any sharp pain, that's when you want to back off with the pressure a little. If it's a little uncomfortable, then you're okay. You can also, to turn around and see it, just little circles. And you can also move down the neck and over to the sides. You obviously don't want to poke into the front side of your neck, so make sure you're on the sides when you're doing these nice little circles. You can also, when you find a tender spot, you can hold on to it and just do some of your stretches very slowly. And stretch, and all these things are going to help loosen up some of those muscles. Moving down from the neck to the shoulder, one thing I'm amazed many people don't know is using a tennis ball to help get rid of some muscular tension in your shoulders. If you take a nice long tube sock, yes, it's a tube sock even though it's colorful, you can stick the ball in, give it a couple of good twists or more, and from here you take this ball and throw it over your shoulder. Generally between your spine and shoulder blade, you'll want to back up into a wall, and you can just lean against it and move yourself up and down to get a decent massage. You can also put the ball on the floor or use a baseball or a harder ball if you're finding you need a little more pressure. Moving from the shoulder down to the elbow, if you're suffering from tennis elbow or golfer's elbow, very similar to the neck, what you can do is find your epicondyles, they're the bony protrusions on either side, and just come off them a little bit into the nice muscly area. On the top of the forearm here, there are a lot of muscles. They're going to be activated when you bring your hand up into extension. So hold on to them there and just drop your hand down. This is called a pin and stretch, and you can do this all the way down your arm. And doing this periodically throughout your day, whenever you're feeling pain, if you notice a little discomfort or any radiating pain, this is something you can do to help get the blood flowing and to relieve some of that tension. And as far as the wrist goes, a lot of the stretches that Paul showed you in the previous video are things you can do very well to just keep that moving.
So, thanks for watching our video on self-massage and acupressure for the neck, shoulder, elbow, and wrist. In our final video for this series, we're going to be looking at proper posture and movement so that you are appropriately standing and positioned throughout the day for optimal health.